they're safe. So we look forward to your testimony today. Thank you.
Thank you. See, our testifiers are already standing, so we'll swear you in. Do you solemnly swear that the testimony you're about to give is the truth, the whole truth, so help you God? Good, you may be seated. In the middle of the table is our timekeeper. When our members start their questions, it will turn green. They have 5 minutes. When it turns yellow, that means 30 seconds are left. And when it turns red, that we would ask you to conclude your comments. All right, Secretary, do you have any opening statements, or you want to just jump in?
Thank you. I do have a brief opening statement.
Please proceed.
So, good afternoon, Chairmans Harris, Struzzi, and thank you for the time we have set aside today. I wanted to briefly highlight the accomplishments the Department of Aging has been able to achieve in this administration. Our success and progress have only been possible through our work with the Governor's Office, the General Assembly, my fellow cabinet members, and most importantly, partners in our work like the Area Agencies on Aging, AARP of Pennsylvania, and the Pennsylvania Council on Aging, just to name a few. The renewed commitment of this department to empower our stakeholders to not only inform us of what we should be doing, but to have a meaningful and tangible part in bringing support and solutions to the challenges facing older adults. Since 2023, Pennsylvania has benefited from a renewed focus on the investment in aging services. We began with the development and implementation of a nationally recognized multi-sector plan, Aging Our Way PA. We became the 13th age-friendly state in the country. The department has developed and implemented a nationally recognized comprehensive system of evaluation and monitoring of its AAAs, CAPE. We designed, created, and rolled out the PA Care Kit, a nationally recognized resource that is literally helping hundreds of thousands of Pennsylvanians. In record time, we stood up an Alzheimer's and dementia office with a 30-person council. With national partners, we reframed how we view and talk about aging. We have raised up and added new supports for grandparents raising grandchildren. We have begun building multidisciplinary teams and communities to tackle complex elder justice issues and forge stronger community partnerships. We have taken steps to address the demands from older adults for better navigation services. We have stood up for better housing, behavioral health services, transportation, and food security for older adults in every community, large, small, rural, or urban. The Department of Aging has and will continue to bring change and modernization, accountability, and unprecedented transparency to our work. I did this work with all of you, with an incredible team of experienced leaders, a brilliant team of new recruits, 52 area agencies on aging, state partners, community partners, stakeholders, and most importantly, older Pennsylvanians themselves. Our work is far from being done. For our part, the Department of Aging and the Aging Network will continue to keep older adults at the center of every conversation. We will remain committed to continuous improvement and monitoring of the quality of our work, the sustainability of our system to meet the ever-changing needs of older adults, and remain true advocates for their autonomy, dignity, and right to self-determination. Thank you for your time this afternoon, and looking forward to answering your questions.
Thank the Secretary. We will begin with Representative Young.
Good afternoon. Welcome. Welcome to the Department of Aging. We're excited that you're here. And interestingly enough, I just finished a policy hearing to talk about PACE and the PACE-net services and how the costs that a lot of our seniors in the Commonwealth have to incur because of their inability to stay on the program, and how they now have to make some really harsh decisions as it relates to food, transportation, and then medication. And so from your perspective, we also heard from one of the specialists in the hearing who said that, you know, they really strongly believe, they've been working in this space for 5 decades in the Commonwealth, and in this space, they really do believe that there's a correlation between skilled games, lottery, and the cost of such programs for our senior communities, so that the taxpayers would not have to bear the burden of how we're taking care of our seniors in the Commonwealth. So with that being said, in terms of an expert of 5 decades saying that trajectory could sustain how we take care of our seniors in a community, and where they are now with having to make some really harsh decisions for their livelihood. Can you give me your perspective on, do you believe that works, their trajectory works in terms of the skill games conversation in the lottery and those programs impacting how our seniors are being taken care of in the Commonwealth? And if so, or if not, please let us know what your thoughts would be in solving a solution to helping our seniors stay in their homes, live, and make sure that they're taking care of themselves.
Thank you. And I think when we talk about older adults, their needs are vast. I mean, it's very difficult to pinpoint which need is greatest with our older Pennsylvania population. We built a multi-sector plan with 163 tactics that shows the variety and the never-ending need of older adults as we move through this largest increase of our population is something that we need to make sure that we are being, intentional with our investments for. I think that all of us support the PACE program very strongly. The PACE-Net have been there for over 40 years, supporting older Pennsylvanians, helping them live in communities all across this state. But also, we have to be cognizant of older adults need transportation services, older adults need access to nutrition services, older adult needs our protective services. So, like I said, we need to be sure that we are balancing and being judicious with those resources that we have. Fortunately, in Pennsylvania, we benefit from the lottery. I think the real question is, should we expand the PACE program? And I think the answer is, I don't think anybody disagrees with adding additional services or expanding services for older Pennsylvanians. I think it is a matter of timing, and I think that we need to watch that timing very carefully and come to a consensus when is the right time to move on that expansion.
You said it's a matter of timing?
Yes. I mean, with what we see coming from Washington and the fact, like, just this summer alone, we were worried about our nutrition services for older adults being jeopardized. Other programs, like our health and wellness programs and other programs we administer through the department being jeopardized, we want to make sure that there's stability and there's enough data to support what we are going to decide is not going to jeopardize other programs that we have in the Commonwealth. And I think, like I said, more time to study the issue, more time to gather data on the issue would be prudent on our part.
Well, I appreciate that. I will also say that although that it's very difficult for us to be able to fill a backfill from what the federal level is trying to withhold or may withhold from the Commonwealth. In our previous panel, we had the Department of Revenue, and they pretty much said that there is $1 billion left on the table each time we are not taking action and acting what the governor is proposing as it relates to different ways that we can have some income revenue in the Commonwealth. And so I think it would be helpful if you were to help me and I guess the good people in the Commonwealth better understand when you say timing, and I get the federal level piece, but as the state, what other efforts do you think we can support and really champion to ensure that $1 billion is no longer laid on the table while the seniors in our communities can be helped right now?
Thank you. I wasn't part of those proceedings. I wasn't privy to the Department of Revenue's report out at those proceedings, so I defer to the Department of Revenue on those matters and the Governor's Budget Office on those matters, as I don't have information on that before me right this minute.
Oh, okay. Thanks.
Thank the gentlelady. Representative. Representative Krupa.
Thank you, Mr. Chair, and welcome this afternoon. Thank you all for being here and for your advocacy for our aging population. I want to begin by recognizing the great work that's done in my community by Southwestern Pennsylvania area on aging that serves my district in Fayette County and throughout our region. Their partnership with local senior centers and programs like Meals on Wheels absolutely make a difference in my community. Not just for nutrition, but for connection, safety, and largely for our older citizens to remain in their homes. In the 51st District, we saw firsthand how critical these services are. Last year, due to funding constraints, grab-and-go meals at our senior centers had to be suspended. Our Meals on Wheels program, for the first time, had a wait list. And it's deeply concerning because for many seniors, these programs aren't optional, they're lifelines. So it really reinforced the fact, too, that stable, timely funding, and timely being a component of that, is absolutely critical so that our seniors don't fall through the cracks. With that in mind, I do have a couple questions with respect to the current budget, which included an additional $10 million in grant funding for the Area Agency on Aging Network. And that was due, my understanding is, to the concerns from AAAs across the Commonwealth about increasing demands and growing wait lists for services. Can you speak to the current status of those waiting lists statewide for services like home-delivered meals and other in-home support? Specifically, has that additional funding helped reduce wait times or eliminate waiting lists? And what's the average amount of time a senior might have to wait to receive services today?
Thank you. The average wait time, let's dispense with that. The average wait time really depends on the Area Agency on Aging, because that's also dependent on people that are enrolled in those programs. So you can't predict that for each service area, directly. Our wait list right now for meals for the options program, our options wait list is in 48 AAAs. We have 2,255 older adults waiting for additional services. In the caregiver support program, we have 127 caregivers impacted for additional services.
So thank you for that information, but the initial part of your response does give me some concern that if the wait time varies depending on the area on aging, does that highlight maybe where there needs to be some adjustments so that the areas on aging across the Commonwealth are receiving adequate funding based on equity, so that the average wait time is consistent across the state?
Well, I think if we're saying that everybody is waiting for funding, then that would make sense, but everybody is not waiting for funding. 1,371 individuals are waiting because of funding. 860 are waiting because there's no workers or caregivers available to serve them. And there's also 33 waiting for a variety of reasons beyond the availability of workers or dollars.
With a second line of questioning, your general government appropriations or operation appropriation proposes $850,000 to expand evaluation and technical assistance to the AAA network. Could you explain how those funds will be issued, what specific areas of improvement your department has identified within the AAA system, and how that investment will ultimately translate into better service delivery for seniors at the local level?
Thank you. Those specific dollars are earmarked to help us with training and technical assistance, and also an investment in our IT infrastructure to support the area agencies on aging. IT is important because the IT infrastructure and the area agencies on aging uses and the Department of Aging uses has been in place since 1999. There's many struggles, many challenges with that IT system. Supporting that IT system and continuing using that IT system continues to grow in cost every year as less states rely on it because it is antiquated and because it's just a patchwork of fixes and not really getting the job done to the level that it needs to be done. Why that is important is because that data that we use to report back to the federal government impacts our funding drawdown from the federal government in a big way. If our data is not perfect, if our data is not as accurate as it can be, it impacts how much money we have to do these services. The balance of the remainder is for technical assistance and for training for the area agencies on aging. Through CAPE, we have identified very quickly that our area agencies on aging are struggling in their ability to document appropriately their risk mitigation strategies. So when they go in, they mitigate the risk in a protective services home, or a situation, I should say. They are not documenting it to the level they need to. So we have already begun working to bring enhanced training in. I'm sorry, I'm over time. I just saw the light. We're bringing more training in. We're doing more in-services, and we're expanding how we provide them the resources they need to be able to serve older adults in their community.
So we're both out of time. Thank you so very much.
Thank the gentlelady, Representative Kincaid.
Thank you, Mr. Chairman. So the department has noted that there's been an 84% increase in reports of suspected abuse of older adults over the last 5 years. In my office, my staff has seen many cases of financial abuse of our older constituents. Some family members just draining their older relatives' SNAP and Social Security. we had one woman whose granddaughter put a whole car loan in her name, and she had no idea about it until her granddaughter stopped paying on the loan, and she came to our office for assistance. We found the loan. These cases are absolutely heartbreaking. From the annual report of Older Adult Protective Services, you identified 47% of perpetrators are family members. What do you think can be done to help recognize cases of financial abuse and elder abuse in general, when much of it happens behind closed doors and among family?
Thank you. I think, one, as a Commonwealth, and speaking to my colleagues in both the cabinet and other state agencies, working more aligned, working together on how we educate and how we make sure families, older adults, and communities know about the growing problem with financial exploitation of older adults. We're working very closely with the Attorney General's office. We're trying to work more closely with the Office of Elder Justice in the courts in this matter, also the Department of Banking, the state police, just to name a few. This is not just a Department of Aging issue, this is a Commonwealth issue, and knowing that billions of dollars are being exploited from older adults each and every year is concerning. We also can work to update the Older Adult Protective Services Act that doesn't even contain language related to financial exploitation. Something we very much need to do for the protection of older Pennsylvanians everywhere is to identify it and give not only our system the tools to address financial exploitation, but other systems the ability to address it, such as the banking industry, and having the ability to report and hold and the protections they need to make sure they're working with our law enforcement, with our area agencies on aging, and stopping elder abuse and hopefully sometimes being able to recoup some of those losses.
So a lot of the folks that we work with don't want to press charges because these are family members. What, beyond just law enforcement, what can we be doing to assist in these cases?
And again, that's where, as we stand up elder justice multidisciplinary teams in the Commonwealth, that's part of the complex issues and the community solutions. Using victim services, having conversations, enhancing the work and the training we do with our protective services workers and our 52 area agencies on aging, so we can meet those individuals where they're at and talk to them, making sure we're able to speak to these victims and encourage them to do the right thing. But in many instances, we have to respect it is their decision at the end of the day. It is their autonomy and their dignity that we have to respect, and it's their right. And I've been there in those rooms, just like you, trying to encourage people to do what we know is right. But it is their family, and they have a very hard time doing it.
Thank you. So obviously, one of the major issues with our senior population is chronic loneliness and social isolation. So mentoring can provide an avenue for older adults to connect with new people, to feel like they have a way to invest in the community. With that in mind, how is mentoring represented within the Department of Aging's budget as a way to be more intentional in building intergenerational relationships and investing in our communities that way?
Thank you. Mentoring aside, intergenerational programming is something we speak about in Aging Our Way PA. It is something that we encourage our 450 senior and community centers to consider. We support our area agencies on aging where they look for intergenerational activities to make sure that we're bringing those populations together. It is incredibly powerful to see, especially older adults interact with not just children, whether it be doing reading programs like Success by Six or programs in that lane, but also programs with adolescents and the power that can happen when those two groups get together and find commonality and really enhance the lives in both adolescents and older adults tremendously. So we do encourage intergenerational programming and creativity in how we approach intergenerational programming.
So is there an opportunity with what you're funding in intergenerational interactions to support mentoring? I'll just take a yes or no. Is that fine?
It could be done as a senior center grant, yes.
Okay, thank you. Thank you, Mr. Chairman.
Thank the gentlelady, Representative Nelson.
Thank you, Mr. Chair. Welcome, Secretary. I'm lucky to serve on both the Aging Committee and the Appropriations Committee, so I've been able to participate in a number of hearings with you, and I appreciate all the time that you spend helping to try to keep us informed, of actions within the department. I want to continue along the lines of that subject of protective services and concerns. I'm from Westmoreland County. We're very fortunate to have an effective AAA network, and they do a lot in that protective services space. But one of the things that has repetitively, come up in the area of protective services and some controversy, in October 2025 was one of the latest reports about a program for older adult protective services and the ability of AAAs to respond to reports of abuse. Specifically the Comprehensive Aging Performance Evaluation, or the CAPE program. This assessment covers about, counties have to exceed 75% performance, but your website has a lot of counties below, and that includes even more counties that are below 75% for protective services. How many total counties are below that threshold currently?
Thank you. I believe below the threshold that we would exercise the next level, which is to send out formal notification and to bring their leadership into conversations about concerns about the performance of that area agency on aging. 4 are at right now where we stand of those that we have completed.
So how many total?
That are in need of us, the next level of intervention? 4. Okay, 4 are in the need of the next level of intervention, which is formal notice to their leadership that we will be we'll be talking about timelines for corrections that need to be made.
Because it appeared a review of that had about 14 maybe that are below 75%. Would that be more accurate?
We have a standard that when they fall below 25 metrics, 25 measures within the evaluation, that is when the formal notification process begins.
But we have 14 counties currently involved in that process. We may be bantering a little bit. I mean, that from my side, that's almost 1 million seniors over 65 that are in counties that may be below that 75 threshold.
Right.
Specifically, part of the concern, I think, that those involved in the senior community is the length of time for that review, because my understanding is after the program was introduced, CAPE is saying it would almost be 3 reviews or almost 4 years before corrective or disciplinary actions. Is that correct?
Well, what I just highlighted to you is the exact opposite. We've already acted and put 4 AAAs on formal notification about the changes that need to happen. They'll be brought to Harrisburg. We'll be able to have a discussion with them, their leadership. We'll outline timeframes and goals that need to be achieved for us to move to the next level. So no, we don't have to wait that long.
Okay.
As part of
so it's interesting because, as you were saying, it's the opposite. Somebody else was nodding yes, that 4-year review. So it may be 4 years until disciplinary action is taking place, but there's dialogue that's beginning.
At any point, and if you look at our cooperative agreements with the area agencies on aging, the language is very clear since we've updated them that we have the ability at any time to take these actions that we've outlined if their performance falls below a certain measure.
Discipline. I mean, it's the concern is the discipline holding counties. I mean, some of the counties on your list, we have counties at 33% performance, counties at 53% performance in the area of senior protective services. Right. And so maybe I'm confused, but are you saying now that discipline on counties that are operating at 33% effectiveness is occurring, or is it just talk?
It is, well, I think we need to define what we consider discipline. We have begun the formal process of notifying, and if the area agencies on aging don't hit the benchmarks that we outlined for them, then we would stop, the next level would be to stop their ability to draw down additional funds or grant funding without hurting their baseline. Because if you take any action against the baseline funding of an area agency on aging, you're punishing the older adults in that community. So the only thing that, until this administration updated the cooperative block grant agreements, the mechanism to, quote, discipline the area agencies on aging was to take away their baseline funding. And we have changed that and moved that into a series of things that we can do in order to bring the level of accountability up and to improve the performance without impacting services to older adults, which was the danger in the previous cooperative agreement.
Great. I see our time's up. Thank you very much for that explanation.
Thank the gentleman. Representative Friel.
Thank you, Chairman. Thank you, Mr. Secretary. In my district, my seniors are very concerned with transportation. As seniors are aging and we're trying to, whether we're aging at home in place or one of our centers, access to transportation to get to doctor's appointments and medical appointments is very challenging, and it's very expensive for the counties. I live right on a county line, and one of the things I'm finding is that even these transportation systems are not always designed around our medical community's appointments. And when we cross the county line, our transportation systems don't always talk to each other, and there's not good handoffs of taking someone across the county line to get dialysis or something like that. What could we do as legislators, or what could you do in the office to make counties coordinate those rideshare programs and transportation, especially for our vulnerable population of seniors trying to get medical treatments?
Thank you. And I agree with you. This is not just a Department of Aging solution. We need to bring our partners in PennDOT, and we also need help from the General Assembly in fixing some of these issues. To your point, when I was an Area Agency on Aging Director, my frustration was having my shared ride to go across the border into Luzerne County to get my constituents to the VA. Same struggles that you identified. Our transportation services stopped at the Lackawanna-Luzerne County border. So, I mean, it really requires all of us to work to get past those barriers. We do not necessarily have the jurisdiction over these shared ride community or coordinators that PennDOT does, but we do fund them. Our area agencies on aging spend about $6 million or $8 million a year, about 8.1 million to be exact, a year in supporting these operations. That gives us a return on our investment of about $49 million, but we still need to work on improvements and efficiencies, and we need your support to do that at the local level because, again, we don't necessarily have as much jurisdiction in that space as other entities.
No, and I appreciate that. And I think this is one of the areas where you could help us help us in the legislature and obviously coordinating on how those budget dollars can be driven towards more cooperation across those borders to make sure that the medical care that's needed, that those rides are available for those seniors. We're experiencing more and more seniors. I'm going to be one of them soon. And we need to make sure that system is well funded and we're able to get to those doctor's appointments. So anything you guys could do to help us to direct where we could either put funds as our population ages, or how we can enable it through legislation to have those cross-border cooperations would be very helpful. Thank you, sir.
Thank the gentleman. Representative Barton.
Thank you, Chairman, and welcome, Secretary. I'd like to follow up with some questioning similar to my colleague from Westmoreland. Mr. Secretary, under the new CAPE monitoring system, AAA's reviews occur every 18 months instead of the previous annual reviews. Now, I think it's important to note that it's been widely publicized, and critics have published that they believe many of these changes have a relaxed oversight of the county agencies and have weakened the efforts to ensure that our county agencies follow the rules and keep older Pennsylvanians safe. And specifically, critics cite that it's because you once had led the Lackawanna County Aging Agency, and later presided over the association that represents their interests. And so, with the belief that you are, sympathetic to the very agencies that you oversee. So I'd just like to ask some questions related to that. So according to your website, Cycle 1 began in January of 25, and at that point, not all AAAs have been reviewed since the beginning of 25. Is that right?
That is correct.
Okay, so, and I was on your website. It looks like 20, does that sound right? 20 agencies have been reviewed? Is that
20
out of the 52? Does that sound?
20 agencies have been reviewed, and they've
I didn't hear you. I apologize.
20 agencies have been reviewed. 20 agencies have had their exit conferences. 20 agencies are posted on the website. 26 agencies have been completed, and we are waiting for their exit conferences so we can post their information on the website. There are 2 more agencies currently in review.
So would you suggest then that the department's on track to complete all the reviews by June?
We are on track to complete the reviews by the end of summer. That is our goal, is to try to make sure that we are meeting that goal. But
By the end of summer, did you say? I apologize, Secretary.
by the end of summer.
Okay, so, how many AAA agencies have complete review under Cycle 1?
Right now, complete review, 26.
Complete review.
26 complete review.
Okay. Let me ask you, how's the order of the review selected?
The order of the review was established based on those area agencies on aging that had been not reviewed in the longest period of time. So we started with the ones that had not been reviewed. Because remember, from 2017 until 2023, the records aren't good on how often the area agencies on aging were monitored. We can only say with certainty that 2, potentially 3 times since 2017 to 2023 were all area agencies on aging monitored for protective services in a 12-month cycle. Only 2 times we can definitively say that, maybe 3 if we're being generous. So it has not been, when we started CAPE, we did not stop a process of consistently monitoring area agencies on aging for all of them every 12 months. That was not in place when I came in. That was not occurring when I came in. We made corrections to a new system.
It was in place, but it wasn't occurring. Is that right?
Correct.
Okay, so it was in place, it just wasn't occurring, is what you're saying. Okay. And let me ask you this, Secretary. I'm sorry to interrupt you, by the way. When would Cycle 2 begin?
Cycle 2 would begin at the end of summer when we finish the first cycle, as we just highlighted that is our goal. But like any other department, and I think if we discuss the remap process, we'll see the Department of Aging has not been resourced appropriately in terms of manpower, in terms of the staff that we need. So as people take promotions or people have leave, it impacts our work tremendously because we are not a big agency. We do not have adequate resources in many ways to do the work that we're mandated by the General Assembly to do and by regulation to do. Remember, an agency of our size typically functions on between 7 and 10% administration. We function on less than half of that. We function on 3% administration.
So with these changes, do you feel you'll be able to function properly?
With the investments that we have seen.
Effectively and efficiently?
With the investments that have just recently been made in the department, as we expand our ability to do this work, as we continue to grow our capacity, yes, I do believe that. And also I want to highlight, in the legacy system, typically in those monitoring cycles that were completed, about 10%, between 88 and 90% of the area agencies on aging were always compliant. We talked about the 10% that were not compliant, the 10% that struggled. In the CAPE system that you have before you, that number has changed. 15% of the area agencies on aging are struggling and need extra support, mandatory technical assistance. So if it's easier, how is it 5% more, is my question.
Our time is up. Thank you, Secretary. Thank you, Chairman.
Thank the gentleman. Representative Khan.
Thank you, Chairman Harris. Thank you, Secretary Kovalishin. Thank you, team, for all the great work that you do here in our Commonwealth, supporting our older adults. I see patients that have dementia and other related disorders, and their caregivers, and I know that they struggle a lot. Last session, Rep. Madden introduced a bill that would create an Office of Dementia and other of Alzheimer's, dementia, and other related disorders. And we passed it into law. I was proud to co-prime that bill with her. Can you tell us how that has been going since it's been unveiled, how the department has been going, and any success stories that you can talk to us about?
Thank you. And we went right to work with the resources that were provided to us to stand up the ADRD division. We're really proud of the work that we've done in a short period of time. We've onboarded a director, a supervisor, another staff member, and we are in the process of working with our 30-member committee, which has also been stood up. We have 5 robust work groups regularly meeting. They've already had over 30 meetings. 4 robust work groups already regularly meeting. 1 on risk reduction, early detection and diagnosis, caregiving, community, and clinical linkages. All of these have been meeting regularly and really working with our stakeholders to not only identify problems, but really embracing our stakeholders to help us identify solutions. We have worked with our PA Care Kit, and literally we have been able to connect resources in the PA Care Kit to hundreds of thousands of Pennsylvanians, many of which have family members or loved ones experiencing Alzheimer's or a dementia-related disorder. We've worked with our senior centers, we've worked with our adult day centers, we've worked with our caregiver support program to increase our resources available and our training available to all of them. What you'll see in the near future is training with the federally qualified health centers to make sure that they have the knowledge for early detection. You'll see our work with the University of Pittsburgh and Penn State University on enhanced trainings in the communities to help people with early detection and other related trainings. You'll see us working with the Lewy Body Association. You'll see us working with the Adult Day and the AAAs to make sure that we have people and experts in place to support families, support caregivers in this space particularly. It's been some of the most successful work we've done, and we've done it with our stakeholder partners. Partners like the Alzheimer's Association, partners like the Jewish Healthcare Foundation have been instrumental in standing up age and dementia-friendly communities all across Pennsylvania. And we've also been able to engage other stakeholders as well to really see success in this space, working well with our sister agency at the Department of Health to also support the work that they do and our cross-section work in this space.
That's great. I've actually referred a couple patients over there, so really grateful to have it as a resource. Also wanted to ask about Aging Our Way, looking to make sure people are able to stay in the Commonwealth as they retire and live in their golden years, and also attract people to move to Pennsylvania to spend their golden years and retire. Can you tell us about this roadmap and how it will help to attract and retain older adults here in the Commonwealth?
Well, I think Pennsylvania benefits tremendously from our lottery system. Pennsylvania benefits tremendously for the investments that we have made in older adults and the services and the infrastructure. Aging Our Way being our 10-year multi-sector plan to change that infrastructure, improve that infrastructure, as I said, 163 tactics designed to support people living in their communities longer, safer, and with supports and services that they deserve. We do that through partnerships with our area agencies on aging and a variety of stakeholders. We impact almost every facet of life. We impact almost every department within the Commonwealth, every cabinet member that has intersectionality with us. When you look at what we've done with Secretary Dunn and her team and built out a prescription plan for our state parks, when you look at the work we do with Secretary Seiger, making sure older adults have access, with good sidewalks, good lighting, that all comes back to the work we're doing under the umbrella of Aging Our Way PA.
That's great. Last question is about the SHARE program. It's a bill that I'm actually working across the aisle with to help older adults be able to share their house with people that are looking for affordable options. Can you tell very briefly, in a few seconds that we have, how this program helps people stay in their home and have affordable housing, and also what may be the current roadblocks to expanding that statewide?
When the federal funding for SHARE is expiring, so that program, we're looking for resources to keep that program in place will be our next hurdle. As far as SHARE helps by opening up older adults' homes to others, older adults or other people from the community that can share that living space with them with supports and services to help them make sure that, 1, the person's safe, 2, that there's boundaries, and 3, that we can help these 2 individuals that need housing desperately, because housing is such a struggle for all parts of the Commonwealth. That they can live together in harmony and basically share the expenses of how they live.
Thank you, Secretary. Thank you, Chairman.
Thank the gentleman. Representative Flood.
Thank you. Mr. Secretary, we've talked at length in previous hearings about your department's failure to protect seniors and the lack of data when an investigation involves a death. We continuously see news coverage of heartbreaking cases throughout the state highlighting failures to respond to cases and ultimately the tragic loss of life. I would like to highlight a story published in Spotlight PA in October of 2025, where failures by the local AAA and your department led to a 68-year-old man taking his own life to escape abuse. As a matter of fact, this specific population continues to die at alarming numbers while under care of this system. I have Grace-Dale Nursing Home in my county, Northampton County, that for years have issues of abuse. I've held a hearing on it a few years ago highlighting a constituent who died, and nothing has changed. And most recently, in the fall of last year, an Alzheimer's patient endured an exorcism by a deranged nurse who had her fingers and a cloth shoved down his throat. Thankfully, he did not die. Nevertheless, these are serious and egregious situations our vulnerable older adults are placed in. But with regard to the deaths, your department continues to say tracking these deaths during an open investigation is not authorized under the Older Adult Protective Services law. And while the governor does call for an update within the budget, what is your department doing to specifically change these provisions?
Thank you, and I think that you're mistaken about several things, respectfully. One, the Department of Aging does track fatalities on open protective services cases. We guarantee that the area agencies on aging have done their due diligence in connecting those cases to the coroner's office, the district attorney's office, and law enforcement. That is part of our mandate. In fact, we know with certainty that in our last reporting period, that there was 1,700 deaths on open protective services cases. That's 3.69% of the cases that we received in total. 0.41%, not even a half percent, were nexus cases. Those are cases where there's a correlation between the protective services case and the death of the older adult. Those cases were checked by the department to make sure the area agencies on aging did everything they needed to do and reported those. The balance, the 1,512 cases, were also checked to make sure that there was no mistakes, that the nexuses did not exist, and were verified that the area agencies on aging did their due diligence. We have this process. We have been doing this process. It is not the same process they did in the previous administration. It is changed, it is documented, it is more formal, as opposed to the process before I became secretary. It does exist. What we are asking for is something totally different, and that is a fatality review process that is like Act 33 in the child welfare system at the county level to support county agencies working with their communities to help with complex cases, to identify flaws in their policy and practice and improve them. We track our death data. Unfortunately, we do have older adults pass away while we're working with them. We track it and we verify that the area agencies on aging have done what they're supposed to do in those matters.
So the governor's budget themes calls for the creation of the older adult fatality review team. Is the intent to finally address this egregious overdue omission in OPSA?
This is, yes, is to fix something in OPSA that should have been put in place. Like I said, having spent 17 years in child welfare, having conducted Act 33 meetings myself, having written those reports, not having that in aging is something that we need to correct together. It's an important part of the process.
And in the case of that 60-year-old man who had killed himself, did the AAA in that case receive any punitive action for the handling of that case?
Thank you. We cannot speak to the specifics of any case.
Okay. Mr. Secretary, the governor has called for an update to the Adult Protective Services Act, or OPSA, to include glaring omissions such as the recognition of financial exploitation. While such an update would likely be an undertaking, would your department be willing to work on incremental updates so we can quickly get the needed updates without the weight of a larger omnibus bill?
Thank you, and I have always stood by. We haven't walked away from the table. We will continue conversations to get OPSA updated, and we'll continue to be a good partner and negotiate in good faith.
So you are willing to give incremental updates?
I'm willing to negotiate in good faith.
Thank you.
Thank the gentlelady, Representative Abney.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, and your staff for being here. We had a conversation about the governor's housing action plan last week with the Secretary of Human Services. We talked generally about the impacts of that plan on folks who are facing housing insecurity, particularly vulnerable communities. But I wanted to kind of talk to you a little bit specifically about the housing action plan and as it relates to seniors and what it's going to do to benefit our seniors across the Commonwealth.
Thank you. We at the Department of Aging, we focus like our sister agencies and like the plan highlights, we have been focused on making sure there's accessibility, affordability, and availability of older adult housing everywhere in the Commonwealth. What we heard when we did our stakeholder engagement through Aging Our Way PA is housing is the #1 concern of older adults in every one of our 67 counties. It is something that we as a department are passionately working on internally and externally with our partners. We spoke briefly about the SHARE program, how that has impacted our work. We've talked about ECHO as our elder cottage housing opportunities that we are standing up in communities across Pennsylvania. But we need help in that space from the General Assembly to help us deal with some of the challenges we have with zoning in certain areas. And we're working, again, with our sister agencies who have a broader bandwidth with housing than the Department of Aging to make sure that, again, older adults have the safe and stable housing that they deserve, that they can afford it, it's accessible to them, and it works for them and their needs.
Got you. Are we able to, by any chance, quantify what the housing need across the Commonwealth is specifically for seniors? Is anybody taking data the way that we talk about housing in general, or the lack of housing in the Commonwealth? Do we have any targeted quantifiable data that speaks specifically to our seniors?
The Department of Aging doesn't, and
Okay.
I think the challenge with some of that data is the variety of housing challenges that are out there, whether it's people who are struggling with their property tax, whether it's people that are struggling with the home that they own that they can't keep maintenance on, whether it's people struggling to find an affordable unit. The variety is endless in our 67 counties. We know, though, that older adults have responded that this is their #1 concern. So I think that, as working with our communities is really where we find our solutions, and listening to our communities what they need and how that we support them to make change is very important, especially in this space, because what is an issue where I'm from in Scranton is maybe not be the same issue that's in Dolphin and in Harrisburg, and the same could be very different when we get out to Western PA and Pittsburgh.
Is there anything that we can be doing more around this space for housing and security? If people care about senior housing, is there more that we can be doing as a legislature, funding, policy-wise, to help expand access to it?
I think when we identify a barrier, and please helping us knock down those barriers, overcome that barrier, work through that barrier is essential. I know that many of our AAAs have been trying to stand up. I know one in particular is trying to stand up a housing unit and meeting some resistance in doing so, even with partners at the table willing to work and fund the endeavor.
Gotcha. Okay. Thank you, Mr. Secretary. Thank you, Mr. Chairman. Appreciate it.
Thank the gentleman. Representative Alciver.
Thank you, Mr. Chairman. Good afternoon, Mr. Secretary. I have a copy of an article here, and I'm going to just follow up on Representative Flood's questioning regarding, and I'll get right to it. It is from Spotlight, and the article, the title of the article is Records Reveal Shapiro Administration Stopped Tracking Why Older Adults Die During Abuse, Neglect Investigations. And I'll just read the piece out of the article. The spokesman, one of your spokesmen said, a review process is not within the scope of the department's authority under Pennsylvania Older Adult Protective Services Law. Although the statute does not explicitly prohibit the department from tracking causes of death in reviewing whether the investigative failures might have increased that increase of harm, the spokesman also said determining whether an older adult died under suspicious circumstances would require department staff to investigate those causes of death further, which she said the department does not have the authority or the expertise to do.
So as I just highlighted, we look at data that shows the cause of death of the older adult. We don't look at whether that cause that was indicated to us, we don't look beyond that cause. So if the data that we receive says the older adult died of a heart attack, if the older adult unfortunately passed away because of cancer, that is where it ends. We do not have medical expertise to go beyond that. That data is reported to us from our sister agency. It is the data that is formally entered on that older adult's death certificate. Our Older Adult Protective Services Act doesn't even define suspicious death. So, I mean, what we do is we check the information that we have available to us from a verified source from the Commonwealth, check the work that's being done at the Agency on Aging, check to see if there is a nexus, a connection in the investigation between the death of the older adult and the case that has been referred to us, and refer it to the proper authorities, which is the coroners, the district attorney, and law enforcement to take the investigation to that next step, again, which we are social workers. We don't have the authority to do any criminal investigations or medical examiner investigations.
Okay, thank you. Thank you for clarifying that. In Wayne and Pike counties, our AAAs do an excellent job servicing our adult senior citizens and oftentimes talk about issues with transportation, lack of healthcare infrastructure and access to, and a myriad of other issues. Mr. Secretary, since fiscal year 2024-25, your department has received approximately $6 million for Aging Our Way in PA. The proposed budget indicates an additional $3 million for this program to transform infrastructure and coordination of services for Pennsylvania's older adults. Can you specify what this would entail and how it differs from the current year's initiatives?
Thank you. Aging Our Way PA, our 10-year multi-sector plan, has been built off of each year. So we build every year. It is not, there's 163 tactics. It's a 10-year multi-sector plan. We build off of each year as we accomplish tactics. In year one, we accomplished by standing up the PA Care Kit, built the Grandparents Raising Grandchildren Helpline, C-screen interventions in communities that are volunteering for it in the Commonwealth. We became the 13th age-friendly state in the Commonwealth. We built the ADRD office. We have the prescription plan for nature with the Department of Health. This is a long answer, so if you want the entirety, we have reframed senior centers to make them more viable and more welcoming to the new older adult population. And we've had the, this might seem small to some, but not to older adults. We had the older adult showcase. In year two, we worked on the direct care worker blueprint to bring that direct care worker blueprint to life in Pennsylvania with our stakeholder partners, promoted life and day programs, built the local companion with the Pennsylvania Council on Aging to help implement the plan, modernized the aging network through our national partners, started a program with the University of Pittsburgh to improve lighting safety in the homes in Pennsylvania, stood up suicide prevention from older adults, and made sure that we are reframing the adult day system to make sure it's at capacity. I can do years three if everybody would like to hear year three. Year three, again, refreshing the Pennsylvania Link. The older adults in every community in Pennsylvania said we need better navigation services. Link has been in place since 2016. It has not had a substantial investment. We want to modernize that program, make sure that older adults, specifically caregivers and those individuals living with disabilities, have that navigation service that they deserve in a modernized and comprehensive way. We are localizing Aging Our Way by making sure we're working with communities to implement these tactics all throughout the state. And we're working, again, to get the direct care worker blueprint moving forward that was created in 2019. And we're also working to hopefully see evaluation so that we can show you the measurable metrics of the impact of the work that is happening.
Thank you, Mr. Secretary. Thank you, Mr. Chairman.
Thank the gentleman. Representative Webster.
And thank you, Mr. Chairman. Secretary, thanks for you and your team, and I know all the hard work that has to go behind the scenes to prepare you for today, so thanks to everyone for that. I'm a little bit of a lead, and I have two quick questions, I think. We're all elected, so we have to prepare and run for office but nobody runs for election on the let's make the IT systems better platform, right? But it's really important. So you want to take a few minutes and talk about why we need to modernize our IT systems?
So thank you. And it is incredibly important to us because it really has a big impact on the dollars we draw down from the federal government. Our IT system went into place in 1999. That's the year I began my career. I am not a young man. That IT system has only had a series of patchwork fixes over those years to try and modernize it. We are one of the only states using this IT system. As we become the only state using this IT system, it will become incredibly expensive for Pennsylvania. Others have moved to modernized systems. One small example of the savings is we moved our ombudsman platform off of this platform to a new platform. We immediately started saving $250,000 a year. Doesn't seem like a lot in the grand scheme of the state budget, but it's a huge amount for the Department of Aging. We also want to make sure that the data we're sending to the federal government is as accurate as possible. Through painstaking efforts this year, we identified 200,000 points of data that we have missed traditionally. We had to do a different search because the IT system didn't give it to us. We found 200,000 different points of data to report to the federal government. That impacts our drawdown tremendously. IT is also responsible to give us the data that the General Assembly demands of us so that we can report it accurately and quickly. So not only does it help us document and make sure our cases are done, helps us with our monitoring process, it does benefit Pennsylvania by providing more resources to it, the better our data is.
Thank you for that. Switch topics completely and talk about caregivers, because there's a woman in my house who's been a caregiver for our elders, and in a different scenario, but I'd like to follow up and ask you to talk a little bit about the caregiver support program, who qualifies, how do you get some funding for that, and what do we really need to do? What could the legislature do to make that program really support the men and women, and particularly the women who take on that role for our families?
The Caregiver Support Program is one of our more progressive platforms at the Department of Aging. It serves grandparents raising grandchildren from 55 and older, and then it serves a variety of caregivers in every capacity across the Commonwealth. We do have a waiting list for the Caregiver Support Program right now, but we have seen the steady growth. We are supported with federal dollars for the Caregiver Support Program as well. This program is a reimbursement model that we have in the Commonwealth, that an individual can submit their approved expenses or what we would approve in expenses and be reimbursed to a certain degree of what it costs them to care for that individual. I'll use a personal example. Before I came to aging, my grandparents benefited from the Caregiver Support Program. My grandfather was proud to say that most of the care of my grandmother that he was administering, it was a flip in that situation, was covered. 80% was covered by the Caregiver Support Program. It helped my grandmother live in the community longer. It kept her away from a nursing home, thus saving Pennsylvania dollars that would have gone to her care earlier without it.
Yep, and I'm going to hazard a guess. I know this isn't a medical opinion, but I'm sure that extended her life and welfare as well.
It did.
It's so powerful. Yeah. Thank you for all of that. And Mr. Chairman, thank you.
We thank the gentleman, Representative Mako.
Chairman and Mr. Secretary, thank you for being here. I got a quick question about the Resource Evaluation Mission Alignment Project, REMAP. I asked the Revenue Secretary about this earlier, but my understanding from the executive budget, we're in round 2, I guess, of that, and your department fell under it. You're looking for inefficiencies and identifying them, finding what's effective. Can you speak a little bit about what that review, has it been completed at this time?
Our REMAP has been completed, yes.
Can you speak a little bit about what cost savings you guys may or may not have found?
Thank you. I
understand you don't get your funding from the general fund. I get that.
And I thank you, and I highlighted before that what we operate on administratively is less than half of what our agencies of our size operate on. When you look at 7 to 10% is the typical admin for an agency of our size, we're operating on just about 3%. We are a very lean agency. What is unique about our REMAP process is it discovered that we needed additional resources in order to stay compliant with our monitoring requirements. We needed additional resources to make sure our IT infrastructure that I just highlighted, it was sufficient, and we needed additional resources to basically complete our mission and our what is asked of us of the General Assembly. Unique, I know, and when you think of efficiencies, but when you're operating a department at 3% admin, I think we can say we are doing everything we can to be lean. I also just highlighted for a fact, why we're trying to move off this IT platform, and again, a cost savings measure. And we still take conserving resources very seriously and continuously find ways to do more with less and to make sure that we are, maximizing the resources that we are graciously allocated to carry out our mission.
So you identified inefficiencies as far as funding in your current funding stream goes, and you need more allocation for, I guess, rectifying those issues. Once those issues are corrected, do you find that your current funding stream would be appropriate at the level of funding you got?
I think it's prudent we're in the process of onboarding 16 additional staff members to the Department of Aging, so we're putting those people in place, getting those individuals into the positions they need to be in. It's premature for me to say if that is enough or if that is too short until I have those people onboarded and in place and we have them, carrying out the work that, we believe it's sufficient right now, but until we get them out there and doing the work, I can't speak to the evaluation of our process.
I understand that. And then once you bring these on board, these 16 people, will you be able to supply a report to the General Assembly so we understand what is actually happening with the department for adequate funding?
I would be happy to report.
Okay. Appreciate that, and we look forward to seeing that. That's it.
Thank the gentleman. Representative Donahue.
Thank you, Mr. Chairman. Thank you, Secretary, for being here. It's good to have constituents in high places. I just have a quick question regarding your CAPE process. Since rolling out the CAPE, or the Comprehensive Aging Performance Evaluation, has the department been able to identify any significant data trends based on the monitoring of results so far?
Yes, we have, and thank you for that question. One of the flaws of the legacy system was you were identified as non-compliant and you were required to go backwards and fix the work that had already been done. The change in philosophy with CAPE is making sure that we make sure the work is better going forward. One of the things that we're proud of with CAPE is being able to identify statewide trends. The statewide trend that we have identified is the area agencies on aging in question have challenges documenting their risk mitigation strategies. That is not that they have challenges with risk. That is not that they are leaving people at imminent risk of harm. And that, by the standard of law, is something very different. Their documentation on what they've done to mitigate risk has been a challenge, and that impacts their overall scores in documentation and risk mitigation. We have been started already training the area agencies on aging, providing enhanced technical support. Area agencies on aging that hit a certain threshold are required to have mandatory technical assistance, and really working through this identified trend to make sure that those who have not been monitored start to make the corrections now rather than waiting for their monitoring to happen.
Thank you for that. Thank you, Mr. Chairman.
Thank the gentleman. Representative Brown.
Secretary Kovulich, according to the 2024-25 Older Adult Protective Services Annual Report, there were statewide reports of elder abuse totaling 66,719 last year, which absolutely sickens me. There's been 84% increase in the annual reports of need over the past 5 years. In an effort to prevent abuse, I've addressed it by introducing some legislation in the form of House Bill 1350, which would allow residents of skilled nursing facilities to place cameras in their rooms to monitor care. I can tell you from a personal experience, I recently had to, unfortunately, place my father in a nursing home, and I chose to put him in Ohio, which is 20 minutes away from me, because we do not have this available right now. And my father has Alzheimer's, which is one of the more likely groups to potentially be abused. So I'd like to know what your position would be on legislation like this.
Thank you. And we, as the Department of Aging, we are the state unit on aging responsible for the Older Americans Act being carried out across the Commonwealth. We don't have jurisdiction over nursing homes per se, but our role in this space is through our ombudsman office. The statewide ombudsman reports to the Secretary of Aging. The Department of Aging's work is with the statewide ombudsman, and the statewide ombudsman's position is to make sure that we're protecting the rights of individuals like your father, to make sure that they have their voice, that they make sure that they have the supports and services that they need. So really, our ombudsman program is there to just guarantee the rights and the protections of older adults. I would have to go back and look at any specific legislation, but we're always looking to enhance the protections for older adults, but also we have to balance that out with respecting their wishes, their dignity, and their right to autonomy. I understand these concerns with the nursing facilities, but I don't have jurisdiction over them.
I understand, but you would still have influence on it. And I think we owe our seniors more dignity in these final stages of their life. Having an ombudsman is great, but they just are there in a snapshot of time. And people like my father can't have a voice in this situation. I think it's vital that we can be viewing the care that they're receiving. So I would hope to have your support in the future.
Well, we would support any enhancement to an older adult's life that made it better and protected them more.
Okay, I appreciate that. Thank you.
Thank the gentlelady. Representative Bellman.
Thank you, Chair, and thank you all for being here. I have a lot of senior citizens in my district that want to stay active, and they also want to supplement their income. So I wanted to see what is the department doing to connect older Pennsylvanians with the Senior Community Service Employment Program, and also I wanted to see, is there a way that we can increase the wages for that program as well?
Thank you. That is a federally funded program that we administer through several of our partners, AARP for one, and some of the area agencies on aging. We do our best to connect those older adults to that program through our 52 area agencies on aging, and some of our 52 area agencies on aging even create employment opportunities for older adults. I had 2 CSEP individuals working at my office when I was an area agency on aging director. The struggles with that federal program is that year after year, it's threatened with being shuttered. In fact, we have seen a reduction in our funds that are available from the federal government to run that program. And advocacy on the federal level is necessary to stabilize the program and to make sure that we can continue to connect older adults to it. It's a powerful program. It's done incredible work, and it's an incredible resource to and it's continuously in jeopardy from a federal point of view.
Do you know how many senior citizens in Pennsylvania actually take part of the program?
Right now, it is, in 2024, there was 682 individuals.
All right, thank you. And also wanted to see, there's a lot of people who are taking care of their aging parents, and they come up against a lot of challenges when they're talking about rehabilitation homes or senior homes. If they are to have challenges with those rehabilitation homes or their seniors homes, what resources does your department offer them?
Well, we're always a resource to families, to caregivers, to anyone related to an older adult's issues. So our 52 area agencies on aging are there to support and help with any issue related to an older adult. We may not be the agency with jurisdiction, we may not be the agency that can fix the problem, but we are always that voice, we are always that front door, we're always that connector to make sure that we can help someone address their issues or put them in the hands of the entity that could.
Awesome. Thank you. Thank you for all of your work, and thank you, Chair.
Thank you, gentleman. Representative Rigby.
Thank you, Chairman. Good afternoon, gentlemen. Mr. Secretary, there's been discussion throughout the hearings on the growing aging population in the Commonwealth and ensuing there is sufficient service capacity to meet the growing demand for these services, particularly in nursing facilities. And while I understand that the licensing and payment for these facilities do not fall under your department, I'm just wondering if you're concerned that the seniors who need this level of care will be able to receive it with the number of facilities that are closing.
Thank you. Again, no jurisdiction over the nursing facilities in Pennsylvania in any way, shape, or form. From the reports that I've seen last, we were only at 70% capacity of our nursing facilities. But again, I don't have updated information. I defer to my partners at DHS and DOH on specific numbers related to facility availability in Pennsylvania.
Thank you.
Thank the gentleman. Representative Kozarowski.
Okay. Thank you, Chair, and thank you very much for being here with us today. Representative Donahue claimed you as his specific constituent, but you are from Scranton, and so I get to claim you as one of ours as well. So thank you for being here today, and thanks for all the work you've done in the past. I know your history with the AAAs, especially the work you did in northeastern Pennsylvania and our AAA for our older population. And I know how challenging sometimes that population can be. I know that sometimes they have unique challenges. Sometimes they don't have great support systems. And I know that there are very special people that work in AAAs and work with aging adults. Like I said, I actually also am a nurse, and I worked in Scranton for 25 years, and our population is aging. So I know we've worked in together with your AAAs, and certainly taking patients and sending them back home, having issues that may need some extra support. And sometimes, like I said, they don't sometimes have that support system. So I really want to highlight what your AAAs have done in the, are there 52 of them in this?
52, yes.
52 in our Commonwealth. So they are a great resource for our population, that aging population. But I wanted to talk a little bit specifically about what the governor has proposed as part of his budget to update, and how important it is to update the current Older Adult Protective Service Act. One of the reasons to do this is to address financial exploitations that seniors sometimes have in their lives. And I want you to talk to me a little bit about how updating this act will help the AAAs address the investigations that sometimes happen. So thank you.
Thank you. The update will benefit all of Pennsylvania, and not just the area agencies on aging and their protective services investigations, but other professional communities, law enforcement communities, banking communities, really having the impact that we need for older Pennsylvanians. I spoke briefly today about the fact that financial exploitation is not included in our current OPSA bill, or our OPSA law, I'm sorry, excuse me. We do not address the matter of what is, a suspicious death. We do not have sufficient protections, for older adults in terms of background checks. Some of the facilities that exist today did not exist when those laws were created. So we want to enhance the background checks. We want to make sure that we're not leaving individuals like we had not too far, individuals that have serious, criminal backgrounds working in communities without protecting our older adults. We want to make sure that our language lines up with the Adult Protective Services Act. Again, we want the banks to have the ability to have their duty to report, but also the protections that they need to help us make sure older adults have their finances held so that no more exploitation happens than what they've discovered. We want to make sure that we're correcting the constitutionality issues of the law that's been in place since the Peak decision. So there's no more lifetime bans on employment, but we have a sufficient waiver process to get people who should be working, and back out into the communities. And again, we want to make sure that this law is modernized and we are able to respond to the modern needs of older adults. It was written, almost 40 years ago, and it really needs this refresh and this update to serve Pennsylvania in a modern way.
Yeah, thank you. Is it 40 years?
Nearly, yes.
Yeah. So thank you. Obviously, it needs to be updated to protect our Pennsylvanians. So thank you very much.
Thank you.
Thank the gentlelady, Representative Vanzel.
Thank you, Chairman Harrison. Thank you, Mr. Secretary, for being here today. I, too, want to give a shout-out to our AAAs back in Westmoreland County. They do a great job for our elder population. Mr. Secretary, I want to talk about your C-Screen program. It's a web-based platform to standardize and verify provider screening practices across the Commonwealth. Is this initiative supported by Aging Our Way, PA funding, and how much does the program cost to the department?
Thank you. C-Screen is an Aging Our Way initiative. It's a voluntary process in which the providers are able to share with us their hiring practices. This process was rooted in the insurance industry. Really, what the insurance industry uses to identify individuals' hiring practices to determine what level of risk they would present to writing them a policy. So using that evidence-based model that was developed in our world helps us identify what providers are onboarding individuals to go into older adults' homes, okay, in the best way possible and giving them a rating associated with that. It's voluntary right now. It is not something that is required for providers to do, but our good providers, the providers that are doing great work across the Commonwealth, have welcomed this process and have supported this process. The exact dollar amount for the Aging Our Way initiative.
While he's looking that up, is that something the department covers all the cost, or some do our local AAAs have to contribute to some of that?
We have covered the cost of this pilot. And again, this is a pilot. This is not something that we necessarily will be continuing. We're piloting this across the Commonwealth. We're going to measure to see its effectiveness and then make a determination if this, like other pilots, is something that we should continue. AAAs bear no cost in this.
Okay, thank you about that. The press release announcing this program stated that the local area of agencies will be able to share provider ratings on C-Screen. Who will be rating these providers? How will we ensure that there's integrity with these ratings?
Well, the program itself rates the providers. That C-Screen platform is what provides the ranking and the rating. So that their tool, their evidence-based tool, is what's used to generate the score.
All right. And when this program was rolled out, was there an RFP before we implemented anything with it?
This was a sole source agreement, as there was no other provider in the state or nationally that we were able to identify that does this practice.
So this is, what do I want to say it? It's sole technology. There's nothing else out there like it. Do you think that's something that the state should be getting into with some taxpayer dollars here?
I think that we are looking to find ways to protect older adults, thinking about the individuals that go into their homes, see them at their most vulnerable moments, that see them, when they're about to take a bath, that they're oftentimes alone, their mobility is challenged, their ability to take care of themselves is challenged. Making sure that the individuals are safe to go into their home is of paramount importance to the department. It's a paramount importance to the entire General Assembly and to Pennsylvanians, I think. And right now, we just highlighted that the Older Adult Protective Services Act doesn't have all the protections in place necessary to make sure that person that's going to walk into their home at their most vulnerable moments is not a perpetrator of a crime somewhere or has not done something worse and is now in their home about to give them a bath.
Yeah, I would agree with you. I think, as we heard today from our colleagues, our safety of our senior citizens, we can't put a price tag on it. And if it's something that works and it's definitely a tool in a toolbox that we can use to keep our senior citizens safe, it's definitely worth it.
Thank you, sir.
Thank you.
Thank the gentleman. Representative Curry.
Thank you, Chairman. Good day. Secretary Kavulage and your team, thank you for being here today. I want to just let you know that in the 164th Legislative District, some of my most served constituents are our seniors. And so last week, I went by one of my senior living spaces and kind of talked to them about your visit this week and the fact that I was going to be able to ask you a couple of questions. And guess what they came up with? They came up with, we want to know about AI. So, and it took me by surprise a little bit, but some of them had concerns. We're in a time where our technology is rapidly advancing, and a lot of times folks don't think that the seniors are up on it, but they very much have to be because we live in a world that demands that. And so as we see these advances in technology and the expansion of data centers to support it, can you tell me what the Department of Aging is doing to help our seniors understand these technological advances and how to use it safely?
Thank you. I think, first and foremost, especially what we've talked about at length today, we talked about financial exploitation, and AI is a big part of financial exploitation. And educating older adults on AI in that space is critically important to everyone in this room to make sure that financial exploitation doesn't happen. So while there is a tremendous amount of potential for good with AI, we at the Department of Aging have had to balance that good with some concerns, and financial exploitation and exploiting older adults being prominent in making sure that we're doing we're educating and working with sister agencies, working with the Attorney General's office to continue this education and prevent people from being exploited, because, again, we all know, once the money's gone, it's so difficult to get
Right.
back. Internally, we have a work group developed to talk about the benefits of AI that can be working, and we're also part of national conversations and national work groups talking about AI and how other states have been able to put AI to work. So, like everyone else, we're working with our cabinet, our fellow cabinet members, with our internal teams, with our external teams on a national level to see what benefits can be offered to older adults while balancing protecting them from dangerous exploitation.
Thank you. You all have been so good in the past, especially where I am in Delaware County with getting that information out. So I really look forward to talking to COSA and working more directly with this particular issue since it is growing. And as we know, there are bad actors that are using AI to defraud individuals. We have, the scam jams and those types of events where our DA's office is really involved. Can you explain how the department, a little bit more about how you're educating seniors on how AI can be misused in this way? How can we work together to educate them and keep our seniors safe from these scams? Because that's what we hear most often. And I know somebody was talking about that earlier about, an account being opened up in one of the seniors' name by their own family member. We have a situation right now where we're keeping our eye on it because we're not seeing the constituent, we're seeing a caregiver, and that sends up red flags for us. We want to make sure that we're doing the best, and that education is so important. So do you have any suggestions on how we can better educate as all of our offices are willing to do so?
Well, first and foremost, our 52 area agencies on aging are always out at any event that calls for it, whether it be a night out, whether it be a senior fair that's being held by a representative or a senator. We're out there with information, sharing and discussing that in every one of our service areas across the Commonwealth. Whenever we're invited, we make it a point to be there. Again, working with partners like AARP, the Department of Banking, doing the robust work that they do all across our Commonwealth, going to senior centers. But also it's important to think of different venues. We have seen that we spend a lot of times at senior centers, but oftentimes we need to be doing events at public spaces like libraries to bring broader audiences in, to get that information into more hands. Anytime anyone wants to do a partnership in this space, we are willing and we'll be able to find partners to collaborate and get this information out the best we can.
And one last question, does the department have any kind of locator for seniors that may have to transition from one housing location to another?
That we don't have.
Okay, I would love to talk to you about that. Thank you so much. Thank you, Chair.
Chair thanks the gentlelady and recognizes Representative Marcel.
Thank you, Mr. Chairman, and thank you very much for being here today. Mr. Secretary, as you noted earlier, there are 4 AAAs out of compliance. You said at one point that the AAA would receive a formal letter with benchmarks to achieve in order to come into compliance. What is the provided time frame for the AAA to reach those benchmarks?
That varies by need per AAA. So that would be based on their their practice improvement plan, what they are required to do. So you can't say that they all have the same practice improvement plan. They all have deficiencies in a variety of areas. So it would be based on their individual. Those letters have gone out, and we are in the process of scheduling them with the AAAs and their community leaders and their leadership to discuss those said timelines and those corrections that have to be made.
Okay, and what occurs, I know there are a lot of different circumstances, but what occurs if those benchmarks are not met in that amount of time that you've requested?
So for the first time since I was secretary, we have a clear outline of what that process is. That did not exist before. We now say that if an area agency on aging is failing it, we bring people in for leadership conversations, put them on formal notice, give them their timeframes. If they miss those timeframes, their baseline funding is not impacted, but they are excluded from receiving grants such as seniors and community center grants or additional funding that becomes available to the Department of Aging through the Administration of Community Living or part of the funding redistribution. They are excluded from that process, but their baseline funding isn't threatened. If that does not, if we don't see corrections and we don't see improvement, then we have the ultimate step that we can take that can't be taken lightly because, again, when we take any of these steps, you potentially jeopardize services to older adults. and that's something we can't disrupt. The process of de-designation is not something that we have talked about at the Department of Aging, but we, as you know, in this administration have made part of the accountability process. It is clearly outlined by the Administration of Community Living how this process must happen. We have updated our APD from 1985 to clearly outline how it would be done in Pennsylvania. We've included the language in our cooperative block grant to talk about the de-designation process. If we got to that level with an area agency on aging, community partners like yourself would be put on notice this was happening in your district. Public hearings would have to happen, public input would have to be, and we would have to talk about how this timeframe would be and what would be the next process to onboarding a new area agency on aging. It is not simple, but it is a process that we have very much shored up in this time.
So what you're saying is that there's a very transparent and public way that these next levels of intervention are?
Yes.
Exactly. Okay, thank you. So you stated in cycle 1 of the CAPE monitoring review that would conclude by the end of the summer, but that 18 months would actually put it at the end of June. So are you delaying? Like there's a discrepancy between June versus end of summer. So I'm just trying to figure out what that is.
Well, again, we have faced challenges with making sure that we have adequate team to do this as people are promoted, as people move to other positions. That impacts our work tremendously. You know, we were doing 3 area agencies on aging at once because of people moving and being promoted. We're down to twice again. We're a lean office. We don't have a lot of fallback, so we are keeping pace the best we can and making sure that we're being as efficient with the resources that we have, but we can only do with the manpower that we are able to, to maximize. The 18-month cycle, to be clear, we do a 12-month look back at the area agencies on aging's work. There is a time for them to build an adequate practice improvement plan that has to be approved by the department, and there's time built in for them to implement the plan so that the corrections that they have to be made can take, and that what we're looking at when we go back out is not just the work we already evaluated the last time we were there. We want to show continuous progress. We want to show continuous improvement. Again, we aren't making this easier for the area agencies on aging. The data is not suggesting that, but what we're doing is identifying trends, training on those trends, and improving the work for older adults everywhere.
Thank you. And finally, what would you say to critics that might claim that some of the changes that your agency has been making benefit the county aging agencies, but not older adults?
Thank you. I think that one, everyone has said, oh, this is easier. We've proven numerically it's not. Okay, that it's not easier. With legacy systems showed a deficiency of 10%, and our system is showing a deficiency level of 15%. So what it is doing is identifying the areas in which our area agencies on aging, not just in protective services, but in all categories, such as the Caregiver Support Program or our Older Americans Act services. Remember, this is a comprehensive evaluation, not just about protective services. What the agency has to do in its entirety to provide the right level of services to older adults.
Thank you. Thank you, Mr. Chairman.
Chair thanks the gentlelady and recognizes Representative Gallagher.
Thank you, Chair. Thank you, Mr. Secretary. I'd like to talk about senior center grants. The proposed budget includes $3 million for senior center grants, which is the same amount as funding for the 25-26 fiscal year. What types of things can the senior centers use this funding for?
Thank you. There's 2 types of senior center grants. One competitive, one base funding grants that we give to non-competitive grants that we help make sure that really every senior center in Pennsylvania benefits. All 450 senior centers recognized by the Department of Aging are able to benefit from the grant process. Those who choose the competitive process can choose it for projects, and we've seen things like new kitchens, new floors, HVAC systems, whatever infrastructure that they need to improve on to make sure that the space they occupy is sound. We've also seen new initiatives and programs, like the mentorship program that was highlighted earlier. We've seen requests for additional funds like that. So there's a wide variety of asks that can be presented to the department, and we can make sure that we're doing our very best to fund innovation and also keep the infrastructure of senior centers strong.
Okay, thank you, Secretary. Can you tell us what the status of the 2025-6 grants are?
The non-competitive grants have already been distributed, and the competitive grants are in the final phases of review, and they should be ready for release mid-April.
Thank you, Secretary. Thank you, Chair.
Chair thanks the gentleman and recognizes Representative Reichert.
Thank you, Mr. Chairman. Secretary, thank you for joining us here today. I'd like to focus a little bit on the naloxone copay assistance program through PACE. It provides up to $50 in copay assistance at the point of sale in pharmacies for non-PACE consumers and PACE enrollees. Is this program still operational?
Thank you. Fortunately, I benefit from having Mr. Tom Sneddon, who's run the PACE program since its inception, and I'm going to defer to him to answer.
Thank you.
Yes, it's still running under grant from Dept.
Very good. The interagency contract information shows from DDAP that funding for last fiscal year was $17,239. It jumped up to $75,000 this year, and then it's projected to be at $19,000 for the upcoming fiscal year 26-27. Can you explain the large increase this current year, and were additional doses of naloxone provided?
We haven't used much of that money at this point. A lot depends on federal appropriation of that money, but at this point, we haven't used that money.
Okay. Do you know how many doses have been provided?
A dose provided?
Yes. Do you know how many doses have been provided through this?
It depends on the medication.
Okay.
But it's usually a lower dose.
Okay. I know, I go to the pharmacy and a lot of folks do. The doctor might prescribe a name brand, but the pharmacist will prescribe a generic. Is a generic available for this? Is that, or are we paying for name brand prices?
Over the counter is available, but it's infrequently used.
Okay. And thank you. I really appreciate the background information. Thank you, sir.
The chair thanks the gentleman and recognizes Representative Meligari.
Thank you, Mr. Chairman. Thank you, Secretary, and to your team for being here today. Really do appreciate it. I have a couple questions for you, but I want to start off with a question regarding food assistance for our seniors and the Meals on Wheels program and nutrition. So back home in Montgomery County, Secretary, you had visited my district along with Senator Maria Collette at Generations of Indian Valley, which is our local senior center in the Indian Valley in Souderton. And there, that's when you announced, along with the governor, your Aging Our Way PA plan and the announcement of that plan. While there, you were able to see the commercial kitchen that they have and where they offer the Meals on Wheels program. So we know that food costs continue to rise, and this increased cost is putting a lot of pressure on food and nutrition programs across the Commonwealth. One such program is that Meals on Wheels program, as we know. Also, the programs are often dependent upon volunteers. These are volunteer-run organizations that offer a service of trying to keep the cost down by having volunteers, and also they do wellness checks on individuals as well when they go door to door. These are the local neighbors checking on each other. How can we work together to support our local Meals on Wheels programs to make sure that our seniors continue to have the access to food and nutrition that they need and deserve?
Thank you. And much of what we've covered today is about awareness. And I'll say I'm a huge supporter of Meals on Wheels. I'm a huge supporter of the work that they do. Again, this goes far beyond simply feeding an individual. There's connectivity, there's social connection, there's pushback on social isolation, there's added safety features to enhance an older adult's life when we have Meals on Wheels programs knocking on their door and delivering their meals. I think awareness and the discussion of the benefits of Meals on Wheels is necessary. We live in a society that's really focused on convenience, but not necessarily making the best decisions based on information that they have at all times. So I think education and making sure people are aware of what the difference is in types of how a service is provided, that this isn't just simply about delivering food. This is about delivering connectivity. It's about delivering a level of social service, and also standing up community resources. Doug's Place is an amazing resource in your community, and Doug, he really does an incredible job, not just, in terms of Meals on Wheels, but connecting older adults to activities, health and wellness, information, keeping them in their communities, keep them safe, keep them connected.
How valuable do you think that connectivity is, that connection, that wellness check of an individual each time they go to a door with a meal that's been prepared for them?
I don't think anyone here would argue how important that connection is. And sometimes that's the only friendly voice and the only friendly face an individual sees all day. And it's also sometimes their lifeline of information and of just getting them connected to something more. So I don't know if a price can ever be put on that level of connectivity.
I appreciate that. I know that there's pressures within the marketplace right now to try and offer different solutions for meal delivery. I would stress the importance of that wellness check on top of the meal delivery as a service. In addition to that, I wanted to ask you one more question. How will the Office of Alzheimer's, Dementia, and Related Disorders, how will that office utilize new and existing partnerships to execute a robust public awareness effort about brain health, early detection, and diagnosis in the Commonwealth?
Thank you. Some of the work they've already gone to work doing is refreshing our state plan on Alzheimer's that has sat dormant since about 2014. I'd correct me on my date. I'd have to double check that. It's sat dormant. We've resurrected and we're refreshing and we're working with our stakeholders and we're working with members of the Assembly that sit on those committees to make that modern, to make that relevant, to make that actionable. So I think what we've done in a very short period of time with our team, building that committee, making sure we're already doing robust work and looking at things that we had in place in Pennsylvania and making them come to reality has been incredibly important for all of us.
Thank you, and I really do appreciate that. I want to thank you for your work. I want to thank you for your help for older Pennsylvanians across our entire Commonwealth, and thank you for your team as well. Thank you, Mr. Chairman.
Thank you.
Chair thanks the gentleman and recognizes Representative Kale.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here today. I wanted to follow up a little bit on some previous questions regarding your agency's ability to investigate and potential abuse happening to our seniors. Help me understand what your agency's function is as it relates to investigations.
We do not conduct investigations at the Department of Aging.
So you don't do any type of investigation? There's mentions earlier about how investigations end once somebody ends up deceased and it's not carried out to its function. The local agencies do, is what?
Just like child welfare, the investigatory work happens through our 52 area agencies on aging. They have protective services units within each of their agencies, and they're required to have those units. We do not do investigations at the department.
So within those agencies, help me understand that process and the investigations and how they work out. If an investigation is followed through its logical conclusion, do the local agencies have the ability to cite, to fine? What's the accountability mechanism that's in place?
To cite, to fine whom? And most of
the abuser. Like, what's the accountability mechanism?
They do not have. So let's just use an example. If an older adult reports financial exploitation, they're being financially exploited by a neighbor, for lack of a better example, we don't have the ability to punish that neighbor. We don't have the ability to fine that neighbor. We don't have a consequence for that neighbor. That is why it's essential for us to be working with district attorneys' offices and law enforcement that takes the information we gather in our investigation and then can prosecute and do that part of the system.
So you work with local partners and hand over the investigation. I'm just a little bit concerned because you mentioned in a hypothetical situation, if an investigation was ongoing and a patient passed away from something unrelated to that investigation, then the investigation stops and there's no real follow-through on that. What happens to an abuser in that situation? Do you just hand over what you have to the local law enforcement?
Correct.
Do you continue working through the process?
We end our process. That's by the law that we have to follow. We end our process and we hand over what we need to law enforcement and help them in any way we can to facilitate their investigation. You remember we have limited authority over facilities. So, I mean, it would really have to be a very specific instance that we're speaking of about a referral about a facility.
Does local law enforcement use somebody within the aging department to continue an investigation at any time? Or is it just you guys are by law not allowed to continue looking at something if someone's deceased?
We are not criminal investigators, we're social workers. So we give them what we have, and that benefits their criminal investigation. That's the part. They help us maybe with intervening. They come with us on a response. They're there to support us in discussion. But as far as the next level, that prosecutory level, that's in their hands. We support their work.
Yeah, and it is a little bit concerning to me just because those social workers are on the ground. They're working with the potentially abused individual. That individual passes away. They have all of this background, all of this information. They know where to look. They know how to go through with the process. And you're telling me by law that that investigation has to end once they're deceased.
Our investigation has to end.
Yes.
The other investigation that's being conducted by law enforcement, district attorney's office, that is on them if they're going to end it or not. But we can share our information with them to enhance. It doesn't matter. We can share whatever information we have to support their work. We end our investigation, though, at that time. There is no older adult to serve. There's no older adult to offer older adult protective services to.
Okay, and you've touted the multidisciplinary team that brings together local law enforcement agencies. Is that something you're using to address these types of issues and to make things safer for our seniors?
Multidisciplinary teams are not a creation of the Department of Aging. Multidisciplinary teams have existed in multiple human services systems, in particular child welfare, and proven to be successfully implementing policy changes on the local level to enhance investigations like you've been describing. That's the benefit. That's why district attorneys' offices, victim services, the aging offices, medical communities, legal community, that's why local law enforcement, the banking community, that's why they're essential components of multidisciplinary teams, to handle complex cases, to answer complex answers, to bring solutions to the table more quickly.
As it relates to these types of matters, abuse with seniors, is there anything that we could be doing as a legislature to fix a law to give you all more ability to protect our seniors?
We can continue to be at the table looking to update the Older Adult Protective Services Act together.
Thank you.
Chair thanks the gentleman and recognizes Representative Mays.
Thank you, Chair. Happy Women's History Month. Welcome, Secretary. I have brought up this one question or shared this one great example of how we can care for our most vulnerable seniors who are identifying as LGBTQ+. I've talked about the amazing Mosaic Apartments project that is located in my district in the city of Pittsburgh, near the University of Pittsburgh's campus. It's a beautiful 48-unit apartment that is a welcoming space, a welcoming place for LGBTQ+ seniors to call home. It was a public-private partnership with some of our dollars from the state going towards that project. And I'm proud to say that not only was there a groundbreaking, there was a ribbon cutting, and now the units are completely full. Can you talk about how we can replicate this kind of model for LGBTQ+ seniors across the Commonwealth? And I know that my colleague has senior homes in his district, Rep. Waxman out of Philadelphia. Are there other models like this for LGBTQ+ seniors that we can replicate in the Commonwealth?
Thank you. There's models of housing like this, in other parts of Pennsylvania, and I really think how we stand up better housing for older adults in general is we need to continue to be at the table working together. This isn't something that the Department of Aging can solve on its own. This isn't something that the Department of Human Services and the Department of Aging can solve on its own. This is a multi-department, multi-state, this is something that we all need to be at the table focused on together. We know there's a housing crisis in Pennsylvania. We know that we need more affordable housing for older Pennsylvanians everywhere, in every way. And that in order to find those solutions, we have to be creative. We need to work with stakeholders from outside of government. We have to look at how we make sure that each community also has a seat at the table in standing up these solutions, because we can't do it from Harrisburg. We have to do it with the local community. So again, we are here as partners, and we will support the work in any way we can. However the Department of Aging can be helpful in this space, we will. Again, we will do everything we can to support additional resources and accessibility for housing for older Pennsylvanians everywhere.
But would you agree that we need to find more housing, not only for everyone, but for our seniors, but just that there's a specific vulnerability if you're identifying as LGBTQ+. Family structure may not be the same, income may not be what they need to take care of themselves. Most seniors are living on a limited income. I think there's a specific approach with this kind of model, and I really want you to talk about the need for this and how we can expand it. And are there places in this region, in this Commonwealth, are there regions in this Commonwealth where we need to be focused, where there isn't this kind of housing for our LGBTQ+ seniors?
Specifically that data we're lacking at the department, so I would not be able to speak specifically to data that serves there. But again, with this population, with any population of older adults, we are the ultimate advocate for those needs. We do have specialized older adult communities. We have villages. We work with the villages across the Philadelphia area, trying to expand the village model across Pennsylvania. We work with other housing partners too to expand their role in input. But I think any vulnerable community we should be looking at and making sure that we're working to solve their housing needs and additionally other needs. But again, in a broader sense, older Pennsylvanians have told us this is a concern for them in every part of Pennsylvania, and we are responsible as the advocacy group for older Pennsylvanians to fight for those resources for them, regardless of their vulnerability, regardless of how they identify. Older adults need better housing. Older adults need us to be at the table to fight for better housing for them in every capacity.
Thank you. My next question is about another group of vulnerable seniors, and it's those who are returning citizens. They may have been incarcerated for 20, 25, 30 or more years, and they're coming home from being incarcerated as seniors and older adults. I talked with a group of formerly incarcerated seniors, and they talked to me about the fact that they are barred from senior housing, and I wanted to get some clarification from you about whether that's the case or what other circumstances would a senior who is formerly incarcerated be prevented or prohibited from being able to reside in a senior facility.
Thank you. And there are significant challenges for those individuals, experiencing reentry, and we see many are restricted from living in communities because of their distance from a school or a zone that they're not allowed to be in. We have to handle those cases individually and in the community that we're relocating to, because it is a challenge, and as well as individuals, people do not want to rent in some instances to these individuals. So there's a lot of barriers, there's a lot of hurdles, and it really requires a lot of local intervention on our part to talk through those challenges and to find a solution.
Thank you, Secretary. I offer my help and support and assistance in any way I can with both of those populations. Thank you, Chair.
Chair thanks the gentlelady and recognizes Chairman Struzzi.
Thank you, Chair. You mentioned the multidisciplinary teams several times today, and I know my colleagues have, as we've talked about some of these situations that unfortunately ended in tragedy. And I appreciate that you came to Indiana County a couple of months ago to sort of, I don't want to say unveil something new, but there was some funding allocated to our area, Agency on Aging, to sort of pilot a more formalized approach to that. Can you just talk a little bit about that?
Thank you. The Department of Aging has endeavored to build multidisciplinary teams with those identified communities all across Pennsylvania. We used $50,000 in consulting fees to help identified areas like yourself who went through a competitive process and had the best applications to draw down these resources and consulting, stand up the teams in those communities, and support the work being done at the local level. 5 areas were identified, and they were awarded with these consulting hours. They weren't given funding directly. They were given hours of work they can draw down to support what they need to stand those teams up in their communities.
Would that create more of a formal process then, something that could be replicated in other areas of the Commonwealth?
Yes, we're hoping so. We want to see this grow to every corner of the Commonwealth. This is something that we feel very strongly about. We are required to have task forces.
Right.
Task forces are not multidisciplinary teams, and multidisciplinary teams aren't task forces. Task forces have a responsibility to make sure that they're educating and providing a platform of communication to the community They're a broad group of stakeholders. Many state representatives and many senators sit on task forces all across Pennsylvania, and they support that work everywhere in all parts of PA. Multidisciplinary teams are very specific. They are designed for working with across the law enforcement, district attorney's offices, the medical community, victim services, the legal community, the area agencies on aging, to find solutions on complex issues and complex cases quickly. It's not, they're very, their purposes are very different, and they serve two distinct functions. It's not a duplication in any way. It's really making sure, like the community we visited, the connections with the district attorney are strong so that we can continue to support their work in prosecution, and that they can support our work in making sure social interventions are in place to protect those older adults.
So it could be preventative?
Yes, it absolutely could be preventative.
Okay, so the agencies would work together, and maybe in a situation where, an area agency on aging doesn't feel that it warrants law enforcement involvement, having that discussion, having that communication throughout the process could ultimately lead to earlier intervention by the district attorney's office or law enforcement to prevent additional abuse or tragically death.
Our guidance to our area agencies on aging is if you think law enforcement should be involved, communicate to law enforcement. That we want law enforcement involved sooner, because the sooner they get involved, the better their investigations can be. If there's a situation that an area agency on aging needs to be educated as to, oh, you should have called this in, or we should have talked about this, again, yes, you're right. That's a platform for us to correct that at a community level, train it, and make sure it doesn't happen going forward.
Okay, good. The Older Adult Protective Services Act, when is the last time it was updated?
There was an update, I can't put the exact year on, to add a provider to it, but overall, it has not been really updated in nearly 40 years. There was
40 years.
There was a small addition a number of years ago, I want to say maybe 10, that added another provider to the mandatory reporting list, I believe, but the overhaul, like to identify financial exploitation, it's been nearly 40 years.
So it's long overdue?
Well overdue, yes, sir.
And what is the timeline then for the completion of this process?
We have a bill, in the House Aging Committee that we've been working with the 5 caucuses to work through. We've been working with stakeholders like the bank, the stakeholders like the home care associations, really talking through the challenges of that bill, and making sure that we're doing our due diligence to be good, good negotiators, and being, how should I say it? That we're there in good faith to say, okay, how do we make this actionable in Pennsylvania? We're still at the table, and if we need to bring it back and have more discussions, we are prepared to do so.
Is there a target date, though, a deadline?
We would love to see this. We would really, I think we need to see this, as soon as we can. I think we owe it to older Pennsylvanians.
Sure.
To update a law that we talk about financial exploitation being the #1 reported need in Pennsylvania, and the law that we have that governs.
Right, yeah, I hear you loud and clear. I think it needs to be obviously sooner rather than later, but when we hear that from governmental agencies, that usually means whenever we get it done. So I think establishing a firm timeline and a goal to get this into place, a deadline for all this to come together, is paramount. So I would encourage you to work towards that end.
I would love to see it, in effect by July. Well, I would love to see us ready to roll by July 1st.
July 1st of this current year?
Yes, sir.
Okay, all right. Thank you very much. Thanks for being here.
Thank you, sir.
Chair, thanks to gentlemen, and I have the honor and pleasure of being with you and wrapping up this hearing. Very much appreciate you being here and your service on behalf of older Pennsylvanians, or as our Speaker of the House likes to call them, our wisest neighbors. So I thank you very much for your lifetime dedicated to that. Budgets and governments more broadly should be judged on how they prioritize the most vulnerable among us. And I think this legislature and this administration have a lot to be proud of. We heard earlier and talked about the establishment of the Office of Alzheimer's, Dementia, and Related Disorders. We passed legislation, and it was signed into law requiring that making sure that biomarker testing is covered by insurance, and the first ever state funding for research into neurodegenerative diseases like Alzheimer's and ALS and Parkinson's. So to that end, that is that's a DOH, a Department of Health appropriation. But of course, the fact that we'll be researching this dreaded disease and disorder of Alzheimer's and dementia, what sort of cross-department collaboration will you and the department be undertaking in light of that new research funding?
Thank you. And when the Assembly was gracious enough to give us the resources necessary to stand up the ADRD office, we were intentional in how we approach this and making sure that the Department of Health, I'm the chair of that committee, and Secretary Dr. Bogan is the vice chair, with intention that our offices should be working in parallels and supporting each other's efforts in this space, because it can't be handled, it's too big for one department to do, and really blending our work, making sure we're supporting what they need to get over the finish line and them supporting us getting things over the finish line is a critical part of how we do this moving forward, how we maximize resources and make sure that we're putting them to work. Like, we are talking about physician education happening in our system using our resources because we believe in early detection. We believe that we're doing the work we're doing with our stakeholder partners. So work like that is just one example of how we're going to maximize our resources together through discussions, through conversations, and making sure everything that we can do to serve this population has been done. We talk about those individuals we know with Lewy body dementia and really shedding a light on that subject for people that don't understand or know that it happens. We've had several conversations with representatives that have loved ones that have Alzheimer's and dementia, making sure that they're at the table working with us on committees so that their life experiences are also helping us make good decisions on how we move forward.
I very much appreciate that answer and your service. And with that, on behalf of Chairman Harris, I thank the membership for their questions and participation today. We will recess this committee until tomorrow morning, where we begin with the state-related universities, followed by the state system of higher education schools at 1, and the state police that will be appearing before the committee at 3 o'clock. Just make a note of that because that was a rescheduled hearing. So 10, 1, and 3, and we'll see everyone tomorrow. Thank you.
Thank you.